right, so last time so we're going through this acronym, no pressure. So last time we looked at nutrition and optimal choice of beverages. And tonight we're going to cover three parts. We're going to look at the environment a little bit and some of the pieces of the environment that we know affect blood pressure. We're going to look at toxins a little bit, just very briefly, and we're going to touch on some of the medications that can raise blood pressure. And so that would be in the R section. Refraining from pressors and excesses would be the toxins and drugs. So we're going to cover E and R today, the second R, and we'll get to the other parts next time. So let's jump into it. Oh, there we go. So there are three environmental factors that one quickly thinks of that relate to blood pressure. Noise levels have good scientific evidence showing associations with higher blood pressures. We'll take a look at that. Sunshine is a important piece, and then fresh air. Fresh air is also involved. So let's take a look at quiet. I remember when I was a father of a young little boy, just a few months old, and it was just so sweet when he was sleeping and it was quiet, but when he woke up, suddenly the house was full of noise, and it was playful noise most of the time, but when you hear that shrill of the cry, it got your attention. And, maybe pushes your blood pressure up briefly, and that's no big issue. But when you are in settings where you are exposed to noise for a longer period of time, that is going to raise your blood pressure for a longer period. And so the first example I have is road traffic noise. Some people spend a lot of time exposed to road traffic noise, depending on where they live, depending on their work environment. Road traffic noise is linked to higher blood pressures. And there's a lot of research on this. There was a 2010 meta-analysis looking at this. And here's a little summary statement from that. The results of this meta-analysis demonstrated the existence of a positive and significant association between noise annoyance from road traffic and the risk of hypertension. So not only do you get the issue related to the frustration and the struggle of being in thick traffic, and you're kind of fighting with people a little bit, trying to go forward, and that can get you a little bit, get your blood pressure up a little bit. But not only that, it's the noise as well that can raise your blood pressure, and so that's something to think about. In fact, the closer you live to a major road, the worse your blood pressure will respond to the noise stress. So that noise, and the more you're exposed to it, the more annoying it tends to be for people, and it's that response. If you sleep on the side of your house facing a road, you will tend to have higher blood pressure than if you sleep in a room on the opposite side of the house. So even just that distance from the front of the house to the back of the house can put, they've been able to detect differences in people's blood pressure. Also, a very common exposure is occupational, and there's numerous studies out of China looking at this, and they're a very industrial country, as are we, and they have a lot of very significant noise issues in their cities. And it's much stronger, in fact, than just road noise. It's a very strong relationship between occupational noise and getting high blood pressure. It's a 2.55 is the odds ratio there, and that's a significant association. And so high blood pressure is definitely related to noise. So if you have a way of reducing noise in your job, if you are a contractor or you're involved with some kind of heavy noise situation, take care. Cover up your ears. Avoid heavy noises. They raise your blood pressure in addition to hearing loss risk and all that. Sunshine, let's take a look at that. Sunshine is amazing. So there's been a lot of research, a lot of even randomized trials looking at vitamin D supplementation and trying to improve blood pressure. And they haven't found that if you take a pill, that it lowers the blood pressure. But what we do know, and this is a well-established mechanism, and also studies show the same, is that sun exposure itself, getting into the sunshine, is associated with lower blood pressures, systolic blood pressure specifically. And so when the sun hits your body, not only does it warm you up, which of course dilates your blood vessels, but it also produces changes on your skin that literally lead to the absorption of nitrates into your body. And those nitrates, nitric oxide, is generated in a fuller way, and that lowers your blood pressure. So we want a moderation in sunshine. We don't want to burn people. We don't want people to have problems with excess sun exposure. And so we recommend 30 minutes of sunshine between 11 a.m. and 2 p.m. whenever available in non-winter months. Obviously, avoid burning. And vitamin D is very good for many other things. Even if it doesn't have a clear relationship to blood pressure, it helps your health. It helps infection risk, bones, muscles. A lot of different aspects are improved by vitamin D, your immune system. And so we recommend vitamin D levels of 30 to 40 just for your general health. All right, and finally on this section, fresh air. So fresh air is very important. Make sure you breathe high quality air whenever possible. If you can open a window, if you can adjust your environment in any way to improve the quality of the air you're breathing, do it. We're starting a clinic right now. We brought in some plants into our clinic so that we can improve the quality of the air. One plant even in a smaller room can make a notable improvement in the quality of the air in that room. So don't be afraid to bring in some plants. I'm not the greatest gardener. I'm trying to get better at it, Dr. Nilsson. But I appreciate having the plants, and I've assigned my my administrator to water them to make sure that they don't die. All right, so obviously when it comes to fresh air, the number one exposure of dirty air is our own doing, and that has to do with taking in tobacco. Every cigarette brings air into your lungs that is intoxicated with all sorts of carcinogens and toxins and so on. And some of those chemicals contribute to the raising of your blood pressure, including nicotine itself. And so every cigarette raises your blood pressure. It lasts for about 30 minutes is the amount of time. But the thing is people tend to smoke enough that they're just raising their blood pressure all day long, even though the amount of time is a relatively short amount of time for each cigarette. So, and of course, the first cigarette of the day raises the blood pressure the most, and we got a little graph here for that. So you can see that on one side, you got the rise in the blood pressure there, and then you have the minutes since the first cigarette. And so you have your first cigarette, and there's a huge increase, sometimes 20 points increase in your blood pressure after that first cigarette. So we encourage people, now's the time to quit. If you can go ahead and reduce, at least if you're not ready to quit, that's a very wise thing in terms of reducing your risk of high blood pressure and the risks thereof. And then just city air pollution in general, even if you're maybe not right beside a really noisy road, the impact of the various activities going on in a city affects the quality of the air. And thankfully, Chattanooga is not affected by this in a severe way. And it's a blessing that our cities here in Tennessee are pretty low in the air pollution, but it does probably raise the blood pressure, by about 1 point here in Tennessee. Whereas, in different parts of the world, different cities, it can be as high as, probably, 10 to 20 points sometimes. So the air pollution can be in very severely polluted cities. All right, so that's it's from a variety of different reasons that the air pollution builds up, whether it's the emissions from the vehicles or the industrial, factories, fuel burning. The dust itself has a smaller impact. The fertilizers in nearby farms and so on. So your air pollution exposure is worse when you live close to a highway. It's worse with warmer temperatures. So hotter temperatures actually is more damaging in terms of the air pollution. We see that a lot with the asthma cases. We get a lot more asthma cases in the summer coming into the doctor because of the heat. And so the way the air works, the toxins are grabbed into the air in a higher concentration when the air is hotter. And then having high blood pressure already. So if you already have high blood pressure and you're exposed to some air pollution, maybe you are in a setting where there's a lot of vehicle exhausts and you're breathing that for a little while, and that's going to raise your blood pressure if you already have high blood pressure. And then if there's a lot of roads right around where you live and there's a lot of traffic on those roads, just the whole setting is going to have an impact. Thankfully, in Tennessee, this is a relatively mild issue. Okay, let's take a look now at the next section on toxins and drugs. It's a fascinating section to me, and people are actually exposed to this a lot more than they realize. So when it comes to exposure to various kinds of harmful things, we want to do everything we can to avoid that, and have moderation in what's good. You can overdo what's good. But and that's the concept of temperance, which we absolutely embrace in this program. So try to have a moderation of the good and avoid the harm. Okay, so if you have high blood pressure, you probably, if at all possible, and you can certainly discuss this with your physician. Hopefully, your physician is thinking about this right, the moment they are discussing it with you, or if they have you as a patient, you've already been on one of these medicines, they should be talking to you about this. And if they haven't, now's the time to think about it. If you're on corticosteroids, you're on prednisone, or you're on any of those, prednisolone, any of those kinds of things, hydrocortisone, some people have to be on those. Think about it and make sure that your blood pressure is not being raised by that. Birth control pills. Some women are taking those, and those do raise blood pressure. Diet pills raise blood pressure and can, in some circumstances, be quite dangerous. So I don't generally prescribe diet pills. It's better to work at it from other ways. And then the decongestants. This is one that people don't realize many times. So they're having a bad cold, and they'll go to the local pharmacy and they'll pick up a decongestant to try to breathe better. And if you don't know which decongestant to pick up, you could pick up one that's going to raise your blood pressure. And when you're sick, your blood pressure can go up a lot more because things are a little less controlled, a little more deregulated. So you got the Sudafed, that raises blood pressure. That's a well-known one. Pseudoephedrine. You've got phenylephrine. That's a common one. Those are probably the two most common options. So if you have to resort to something like that, go ahead and avoid those options. And sometimes there's some better ways, with supplements and herbals and so on. So, and then the final one that I think is the most common that people will run into, because as you start to get high blood pressure, often you have more joint pains and so on, and they just kind of run together because a lot of arthritis has a lifestyle component to it. Not always, sometimes it's an injury, but osteoarthritis many times has a lifestyle component to it. And so people will be taking ibuprofen, and they'll be taking Aleve, and they'll be taking aspirin and these kinds of things. And unfortunately, these medications raise blood pressure. And I've seen that happen. I've seen people have strokes because they started taking a large dose of NSAIDs and they already had high blood pressure and it just pushed them over the limit and they literally came in with a stroke. So in fact, here's a report from Snowden and Nelson, and they summarized it very nicely. If possible, patients who have hypertension should avoid taking NSAIDs. So NSAIDs, non-steroidal anti-inflammatory drugs. And so very important. So be aware of them. They raise blood pressure. And if you have pain, try to think of other options, other ways to treat this pain. If it's a weight-related osteoarthritis, like you've gained too much weight and you have pain in your hips or in your knees, losing weight is literally going to lower the pain. If you maybe need something for some kind of other arthritic condition or your knees or your hips, you can try turmeric. You can try boswellia. These are supplements. Turmeric, 1,000 milligrams twice a day works great. Boswellia combined with turmeric is excellent for pain control. Boswellia, it's usually around 400 milligrams twice a day, is a great option for trying to improve pain. And then, of course, hydrotherapy. Hydrotherapy is excellent for improving joint pain. This is where you use heat and cold and one or the other, or combining them depending on the nature of the issue to improve the pain, and it's excellent for helping that. And then omega-3 fats in the diet, and also you can take supplements for that. Do a general lowering of the inflammation in the body. Omega-3 has a blood pressure effect, and we'll look at that a little later in another session. But omega-3 improves pain, and making sure you're getting enough omega-3 in your diet is important. So I usually recommend somewhere around 2 grams a day of omega-3, trying to get that. There's 3 major forms of it, ALA, EPA, DHA. They're long names. You don't have to learn the names necessarily, but just realize there's a couple different forms, and it's good to have a balance of them. So we'll look at that more when we talk about omega-3. All right, and then finally, the toxins. The toxins are a lot more ubiquitous than we realize. The 2 most toxic or most contaminated, maybe is the better word, countries in the world, I don't know if you could guess it. It's United States and China. United States and China are the 2 most contaminated countries in the world. In fact, they did a study looking at pregnant women all around the world. And China and the US had, for every single pregnant woman they checked in China and the US, 99.99% of the toxins that they checked were present in those pregnant women. And they checked this massively long list of toxins. And so we have a lot of toxin exposure in our country. And we'll talk in a minute how we get exposed to that, just to give you a little sense of it. But I just want to give you a little introduction. So heavy metals. Some of them are still an issue. Mercury, the big issue with mercury, for most people, there's industrial exposures, there's occupational exposures, but for most people, the mercury issue is fish. In fact, you can basically figure out how much mercury someone has in their body just by asking them how often they eat fish. And it's a very tight relationship there. And the fish take up the mercury in pretty decent doses in the ocean. And even in some lakes, there's the presence of that because of the contaminations from the industrial processing. Lead is becoming less of an issue now that we've taken it out of the gasoline for a long time. And it seems like it's becoming less and less of an issue, and we're really not dealing with it anymore. Arsenic, around here, the big arsenic exposure is going to be well water. So if you have well water, please pay attention to what your concentrations are and make sure that they are not a problem for your current situation. You may be having high blood pressure and wondering why you have high blood pressure, and maybe it's the arsenic in your water. Hopefully it's not. And then cadmium is more of an occupational exposure. And so if you have a job where you think you might be exposed to this, you need to check that out. And then our persistent organic pollutants. These were really becoming a problem in the 80s and 90s, and they're still a problem in America. We haven't done as good a job maybe as some of the other European countries of reducing the amount of exposures, although we have worked at it some. Um, and these are the various kinds of chemicals that are created from a variety of different occupational exposures. It's a pretty long list of different things, everything from anything where there's chlorine involved. So whether it's making paper or making different plastics, some of these kinds of things, you're going to be exposed to these chemicals, and they're in the environment. So here's a graph of how we're primarily exposed to these things. Just take a look at this. This is a phenomenal graph, I think. So our primary exposures, if you look at this graph, you look at the numbers, on the left, you see a list of the foods that are the biggest exposure, and the exposure to dioxins and these organochemicals that cause several different issues. We know it now is related to diabetes. There's certainly birth defects issues. There's issues related to cancer. Most of these things are animal consumption. Beef is our highest exposure in terms of what Americans and North Americans in this case are doing. Dairy is second, with milk being included in there, to just give you a sense of the milk piece. Chicken, pork, fish, and eggs, and then inhalation, soil, water, much less of an issue. So in terms of the exposure that people have per day, these are the foods that Americans are getting the most exposure of the dioxins and of these chemicals that are from just industrial processes. But if you look at per type of food and the concentration of dioxins in a particular type of food, so you notice that the fish on the previous slide wasn't very high up; it was just down low in the levels. That's because Americans and North Americans don't eat that much fish overall for the whole of the population. But if you are a fish eater, notice this: by concentration, fish has the highest dioxin concentration of any food, and it is the highest concentration of anything, unless you're directly exposed to some kind of insult in terms of a work environment situation or something like that. And so freshwater fish is the highest, and that's important to know. Notice the vegan diet. The vegan diet very low, and the plant foods just do not take in and concentrate and accumulate the dioxins like the animal foods do, and the eggs and the dairy and so on that you're getting from an animal, and it's been concentrated in there. So ocean fish is a decent dose, but the freshwater fish is very high. And butter is very, very high as well. And so these have been an issue. There is no known safe dose of this stuff. We believe that, especially in pregnancy and in babies, for example, we don't believe there's probably a safe dose at all. We think there's probably tolerable limits, and our intake is kind of close to what the tolerable limits are. And some of it may be a political decision on these tolerable limits, because we are seeing people getting nerve problems and getting these unusual kinds of things, and it may be related to these kinds of exposures that people don't realize. And then this is an interesting one that should also be checked out if you can't find any other reason why your blood pressure is high. Certainly the kidneys and the fact that the way things go in the womb when you're a little baby, like Pierre mentioned earlier, and I mentioned last time, plays a role. But Helicobacter pylori seems to, in some studies, have a relationship there. And so if it's inflaming your body, it could be causing some high blood pressure. And there's a couple different bacteria that might have a relationship here as well. So there's a lot of things to think about. All right, so that's kind of the three things that we looked at today: the environment, we looked at toxins, and we looked at drugs. And I just want to talk a little bit about the email that we sent out to you earlier. We sent out an email that had two attachments on it. If you didn't get it, go ahead and take a look at it as soon as you have a chance. One email is kind of the reference, type of options in terms of things that improve blood pressure. And so it's a long list. Certainly, every effort you make to improve in each of those areas improves your blood pressure. But when it comes to changing your lifestyle, it's not something you can do where you can just take all of the list of things that we're going through and try to get it all better. It's just not possible to do it all at once. So what we recommend is take the second attachment that we sent, and that's the personal goals, and make some personal goals. Make some goals of something you want to improve. Maybe you're seeing, as we're talking, that there's some pieces of your life that are quite different than what we're discussing, and you think to yourself, you know what, I'd like to improve this area or that area. And so we encourage you to go ahead and let me see if I can get that up here. We encourage you to go ahead and make some personal goals. Let me see if I can share this with you. So here's the personal goal thing, the handout I made. So you can write down your blood pressure readings there if you want, and then make a goal. So number one might be eat more beets. And then you might, we want you to write down actually a SMART goal. So the more specific you can make your goal, the more specific you get it in your head, the more likely it is you'll accomplish it. So a SMART goal, SMART stands for, and I listed it down here: specific, measurable, action-oriented, realistic, and time phased. So don't just say, yeah, I want to eat more beets, or I want to get more exercise, or I want to get more fresh air. I want to get more sunshine on a more consistent basis. Yeah, that's great. Wonderful. I mean, that's something that I hope we're all hoping for. But it's much more likely to get done in your life if you can get specific. And so, I listed down here, rather than get in shape, join gym at, Southern University, for example, and work out for 30 minutes, 3 times per week for 4 weeks to feel better and stay healthy for my grandkids. So you're listing the reason, you're listing when, you're listing how much, you're listing how. And so that's all very, very important when it comes to trying to improve, and make and accomplish goals. So the action oriented is great. So, you want the goal to, focus most on the process, your own personal actions, for example. So don't just say lose weight. I mean, you can say that maybe in the general part of this goal, but put in your SMART goal, eat baby kale salad 3 days a week during my lunch break instead of the hot dog and the hamburger that I usually take, or whatever. And, or whatever my usual habit is. That takes an adjustment. You have to literally do something different to get that done. It might require some planning, some preparation. It's not always easy to eat healthy. There's not as much money to be made when it comes to eating healthy. There's no kale industry trying to push it on you all the time. You don't, when you're watching TV, there's not the big kale commercial trying to entice you to eat kale. It's just not there. I mean, but when you see the advertisements everywhere for all the fast food and junk food, they have big budgets for that, and they've got to keep enticing you lest you turn to kale. So anyways, get specific with that, and that will be helpful. All right. And then one last thing I want to talk about is that these things aren't easy. that it's not easy to go from a lunch habit maybe of eating McDonald's on a regular basis to eating salads or eating something healthier. That's hard, and sometimes in your own experience in your own brain, you have these big fights that start in your own self. You're trying to push yourself one way, and the urges and desires and so on start pushing you another way. And so, what I'm really excited about in our program is that we're talking about how God can help you. God can help you to have victory over these struggles that we have. Sometimes these kinds of things, these processed foods and so on, they have strong holds on us. I just think about cheese, for example, and some people eat a lot of cheese, and cheese has a chemical in it called casomorphone, from the casein, and casomorphone. Morphone is similar to morphine, and so it literally has an opiate in it that keeps you coming back. And opiates are some of the strongest drugs to kind of grab onto you. And so, if you're trying to lose weight and you're trying to eat less cheese, for example, to have less calories in your diet, these struggles can be great. And so, ask God for help and then act upon the faith that you have, trusting that God is going to help you while you step forward and do the thing that you're asking Him to help you with. And He will help you. All right. Thank you for joining me